Dr. Tom Arnold, welcome to India. Thanks for visiting us and sharing your expert opinions with us. So, what do you think this modern technology is doing to the people's eyes?
I think the technologies we have available today are just truly groundbreaking and revolutionary. The things we can do today to control the progression of myopia or nearsightedness in the population, the tools we have to correct refractive errors caused by diseases like keratoconus, post-LASIK and post-RK ectasias, are just phenomenal. In my career, there's been so many technologies that have come available to all doctors. It requires a little training, requires a little knowledge, and courses like this, the Knowledge Fest, and the BIPOK Council of the Optometric Council of India, these are opportunities for people to learn new skills and really for the benefit of all their patients.
So, do you think the world is going towards more and more myopic?
Oh, I think so. There's no question. The myopia epidemic is here. In Asian countries, in some countries it's over 90%. In America, where I live, over 50% of the population will become myopic. In the year 2020, I believe we're going to have 3 billion people in the world myopic. So it's a truly worldwide epidemic that optometrists and ophthalmologists from all over the world are coming together in conferences like this to share knowledge and share common problems with a goal to solve those problems for the benefit of all patients, no matter where they live in the world.
So do you think apart from or along with modern technology, food is a contributing factor for this, like junk food or?
I don't know, it may be. That's an interesting theory. I think proper diet is important. In the United States, of course, we're famous for obesity and a diabetic epidemic, and that, of course, is food related. Proper nutrition is fine. You know, our ancestors in the ancient world ate natural products, grown and sourced locally, and now we have access to junk foods that cause diabetes and obesity. Too many omega-6s in our diet contribute to dry eyes. So I think it's a complex problem, but I think it needs to be addressed, and further research is coming.
So do you think sunlight is playing a major role in this?
Exactly. There's a lot of evidence from the last 20 years that exposure to sunlight, especially in the early years in the youth, is very, very important. It's how the eyes grow. We're day animals, and so sunlight, exposure to sunlight is a important factor in the proper development of the eye. Studies show that in young people less than 8 or 10 years of age, they need to be in natural sunlight at least 2 hours a day in order for the eye to develop naturally and limit the amount of myopia that may occur.
So, can you suggest any, a quick fix or, something that you can, suggest, because you have so many years of experience, and everybody loves some quick fixes. So, especially for the mothers who are worried about, the children's health.
Yeah.
So what they can do immediately, and what is the long-term plan?
Well, the first step, of course, is to have a complete and thorough eye exam by a doctor who's educated in these new techniques and new theories, and then follow their advice. We have many tools. We have lenses that we can sleep in overnight to reshape the eye and reduce the amount of nearsightedness, eliminating oftentimes the need for glasses during the day. There's certain spectacles we can wear to retard the growth of the myopia. We even have soft lenses, multifocal. So there's a lot we can do. The first thing is diagnosis, and then the doctor, based on the evaluation, can recommend a proper treatment. And these resources are readily available.
So what is your take on this atropine eye drops? People have been talking much now. Does that help?
The research shows that it does, that atropine, eyeglasses with a multifocal correction, orthokeratology, sleeping in lenses, all these are equally effective. It's up to the practitioner's judgment, along with the understanding and cooperation of the patient and their family, which method is best. They all work, but I think that which works best is properly determined on a case-to-case presentation
I guess
basis.
The atropine can be combined with all your spectacles and contact lenses and orthokeratology. So is it a good idea? Of course, I know it has to be individual patients to
Sure.
advisors or caregivers. But do you think that everyone who has a myopia can, comfortably or safely start atropine at any age and continue, and along with that, they can try different modalities?
I think you have to, again, a case-by-case basis. This is a drug you're introducing into a system. I think there may be side effects. And there may be side effects. Personally, as a father, as a grandfather, I think you have to be cautious starting a treatment that may have to be continued for years. So I'm more of a naturalist.
So
I may do something more external
Right.
than atropine.
Are there any reports that long-term atropine has any serious side effects, or any drugs, anything you introduce in the body, it's going to have some effects?
It could be. I don't know of any long-term studies with problems. I truly don't. But I would be cautious. And there are so many experts in the world now in the field of myopia control, orthokeratology. I would seek the care and advice of your practitioner.
Any simple or any serious advice that you want to give it to the Indian mothers or Indian children's as far as the myopia is concerned?
Well, get it checked early. See what the condition is of the child. Make sure your child has outdoor playtime. I would limit the amount of computer use, cell phone use. I wouldn't use a tablet or a cell phone as an entertainment vehicle for your child. Reading is fine. We went to the conference this weekend. It's recommended that for every 1 hour of studying, it should be 1 hour with distance activities, at least 2 hours of sunlight a day. So I would make sure your kids play outdoors a certain amount of time every day. Limit the cell phones and iPads and video games.
Okay. Thank you, Tom, for visiting us and sharing your knowledge with Indian optometrists and ophthalmologists. And we hope that you will again visit us and keep on supporting our education program.
I'm planning on it. I love India, love the Indian culture, and the Indian people have been so friendly, and I'm really impressed with the level of enthusiasm among the professionals here in India. I think they're excited, I think they're eager to learn and really do their best to help this country, and I'm really looking forward to coming back, hopefully next year. Looking forward to returning. Until I do, namaste to all my Indian friends.